Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pain management, and let's focus on the definitions. So the first one, we are going to look at allodynia. Allodynia, it is the perception of ordinary non-noxious stimulus. So it is perception. So this perception of ordinary non-noxious stimulus. So non-noxious stimulus such as pain. Next is analgesia. So analgesia is the absence of pain perception. So there is absence of pain perception. Then comes anesthesia. Anesthesia means absence of all sensation. What is anesthesia dolorosa? So anesthesia dolorosa. Anesthesia dolorosa, it stands for the pain in area that lacks sensation. So there's pain in the area where there is no sensation. Next is dysesthesia. So dysesthesia is unpleasant. It is unpleasant or abnormal sensation. It is unpleasant as well as abnormal sensation. Unpleasant and abnormal sensation. And there is with or without a stimulus. With or without a stimulus. Next we move on to the hypalgesia. Hypalgesia is a diminished response to the noxious stimulus. So there is diminished response to the noxious stimulus. Then this was the hyperalgesia. Next is hyperesthesia. So hyperesthesia. So this is increased response to the mild stimulation. Hyperalgesia is increased response to noxious stimulus. Hyperesthesia is increased response to the mild stimulation. So we saw hypalgesia. So one thing to clarify here is, what is hypalgesia? Hypalgesia means decreased response. Let's recap. Hypalgesia, what we saw was decreased response. Hypalgesia is a decreased or diminished response to the noxious stimulus. So on the contrary, there is something known as a hyperalgesia. So hyperalgesia, what is this? Hyperalgesia means increased response to the noxious stimulus. So these are the terms commonly confused. Next, we look at the hyperpathia. So hyperpathia is the presence of hyperesthesia. So there's presence of hyperesthesia. Allodynia. Next is hyperalgesia, and is usually associated with the overreaction. So it is associated with overreaction and persistence of all sensation after the stimulus. So you have persistence of all sensation after the stimulus. Now we look at the hypoesthesia. Hypoesthesia means the reduced cutaneous sensation. So there is decrease in the cutaneous sensation. And example is light touch pressure or temperature. So there is light touch pressure or the temperature. Then neuralgia. What is neuralgia? Neuralgia means pain in the distribution of the nerve or a group of nerve. So there is pain present in the distribution of nerve. So the distribution of nerve as well as the group of nerve. Group of the nerve. Then paresthesia. Paresthesia. So paresthesia means abnormal sensation. So there is abnormal sensation. So they are perceived without an apparent stimulus. So they are perceived without the apparent stimulus. Lastly, we look at the radiculopathy. So radiculopathy means functional abnormality of one or more nerve root. So functional abnormality, and this is a one or more root. To learn and grow daily like this, please do subscribe.